So there's a lot of misconceptions about breastfeeding and medications, and we wanted to clear that up today. I'm Dr. Nichelle Haynes,
I'm Dr. Kristen Lassiter.
and we're Medical Mamas. This is your place for evidence-based information about your reproductive mental health.
Meaning mental health in relation to reproductive hormone changes like around pregnancy, postpartum, menopause, premenstrual disorders, and infertility.
So today we're going to be talking about the things that we consider as reproductive or perinatal psychiatrists when we're talking about medications during feeding baby time.
Yeah.
So I think it is very important to say that we recognize there are benefits to breast milk.
Yes. There are benefits to breastfeeding and breast milk. And in some people, there can also be, risks that come along with breastfeeding.
It's really hard. Okay. We both have kids. I'm comfortable saying that I breastfed my kids for not a very long time. And people say like, oh, it's hard. Or even some people will say, oh, it's like so easy, it's beautiful, whatever. No, it is really, really hard.
Yeah. I think everybody's experience is unique. And that's why breastfeeding is such a personal decision.
Yeah. For me, it was just like relentless, like around the clock, having to pump and then being away and then, getting a clogged duct or, people get mastitis. There's like all kinds of things that come along with it. And
Yeah.
sleep can be harder.
Yeah.
Yeah.
But breastfeeding and taking medications don't necessarily have to be two things or something you have to make a decision about. There's a lot of medications, especially psychiatric medications out there that are considered compatible with breastfeeding.
Mm-hmm.
But a lot of times people kind of believe, oh, I can't start taking medications while I'm breastfeeding because it'll be dangerous for my baby. So I'm just going to wait and not take medications. But we really want to emphasize that your mental health, if it's not good, that is more risky for your baby in most cases than exposing your baby to a medication. But there's different things that we want to consider when we are thinking about medication and breastfeeding.
Mm-hmm. Perfectly said. Perfectly said. So for me, one of the main questions or one of the first questions that I ask my patients is, what are your goals or what were your ideas about feeding your baby? And that kind of opens it up to whatever they had imagined, whether it's a combo feed or exclusively pumping or direct feeding or whatever it is. I kind of want to get an idea from my patients. What do they really want? What did they want? What do they want now?
Yeah, and I have a lot of patients who are like, honestly, if I have to give up breastfeeding, that's fine. Like, it's really hard for me and it's not working out great. Like, it's not how I thought it would be, and that's okay.
That's totally fine. Right. So if we're at a point where we're like considering medications, I think there are a couple things to consider about the medication itself. That's sort of in question. What are the things that we consider? First, if we have good data about that medication, we want to use that data to inform the decision.
Yeah, hopefully it's a medication that has some research on its use in breastfeeding and effects that it has on baby. But to be honest, with most of our psychiatric medications, all we have are like case studies or these 3 people who took this medication. This is what happened when they breastfed. And so it doesn't give us a ton of great information. And so we more so rely on other information about the medication in breast milk.
Mm-hmm. If we don't have information about it being inherently harmful for a baby to be exposed to small amounts of whatever medication, we'll look at things like relative infant dose, which is like a percentage of the maternal dose that is excreted in breast milk, kind of on average, right? It may vary based on, the fat distribution or the timing of the medication or those kinds of things, but we look at the relative infant dose. And generally our standard is 10% or less of the maternal dose would be considered in the safer range. But of course, we would like that to be as low as possible, because then we have more reassurances that baby's not getting a ton of medication or something like that. So for instance, there are some medications that excrete around 1% in the breast milk. So we would consider that to be relatively safe.
Right. As reference, sertraline or Zoloft is considered kind of one of the safest medications for breastfeeding because its relative infant dose is around 1 to 2%. It's also, we just have used it for so many years and we have a lot of information on it, but that doesn't necessarily mean that it's the safest one for a particular person.
Right. And we have a video on that, like deciding how we think through deciding which medication might be right for someone. So if you want that one, I'll link it in the bottom for people to see. So if we don't have relative infant dose, I think we do for the vast majority of things that we would consider using, right? Mm-hmm. If we don't have that, we could use molecular weight. So we know there's like sort of filters or different ways of medication getting into the breast milk. So if we have a bigger molecule, medicine is like a bigger molecule, it's less likely that it's going to be excreted because it can't just like get through.
Yeah. And similarly, we look at like fat solubility. So medications that are more fat soluble are probably going to kind of concentrate a little bit more in breast milk than medications that are not. For example, this isn't a medication, but marijuana or cannabis is very fat soluble. And so it sticks around in the breast tissue and the breast milk days, weeks later after it's been introduced into the mom.
Mm-hmm. Right. I mean, it makes sense, right? Breast milk is highly concentrated with fat because that helps baby grow and get nutrients that way. And so if it's fat soluble, meaning it dissolves in fat rather than in water, then it would be a lot in the breast milk.
Right.
Yeah. What else? We would consider if we have data on a derivative of that medication. So like there are some medicines where you take this one and then it gets broken down in your body to this piece and this piece, and this is the one that is active in your body. So we may have information about this one, but not this one. And so we might look at this data if we don't have data on this one.
Yeah.
Yeah.
And then we also want to look at the baby, like how old is the baby? How much does the baby weigh? How's the baby doing developmentally? And I will say for the majority of our psychiatric medications, though, we have a lot of patients who are taking these medications in pregnancy, and then maybe they have preterm birth or they deliver their baby early and baby ends up in the NICU. Mm-hmm. And I will say I have not had a single neonatologist, so the doctors that work in the NICU, say, no, you cannot breastfeed on this medication, even though your baby is premature. But it varies depending on each baby and what health conditions they might have also.
Mm-hmm. I think it's really intuitive that a preterm baby, someone who's getting care in the NICU, is different from an 8-month-old. Right? With regard to a million things, but specifically how they're eating, how they're digesting, what their nutrient requirements are.
And their organs and how their organs are metabolizing things or filtering out different things. So thinking about the organ development of the baby too.
Mm-hmm. And then once you're introducing solids, they are getting some nutrients there. I know that they're not like the main source of nutrients, but sometimes breast milk or milk consumption will decrease a little bit around that time. So they might be getting a little bit less. So it really, there's a lot of things we would consider about baby too there.
Yeah.
So maybe we can include some breastfeeding accounts that we like or some baby feeding accounts that we like.
Yeah, so let's see. For Instagram, there is Breastfeeding USA, which is this evidence-based account talking about breastfeeding and kind of evidence-based information. There's also...
I really like the Milk Manual. She's on Instagram and TikTok. I found her on TikTok and she's here in Texas and she's just really lovely and wonderful. And she's a certified lactation consultant that works in the hospital and then has a lot of really great information on her account. So the Milk Manual, she's on TikTok and Instagram. So there's also babyfeeding.coach. She talks about combo feeding, breastfeeding, formula feeding, baby-led weaning, purees, kind of just the whole first year, really, of things that you would need to know.
Baby feeding.
Baby feeding.
And then there's also baby.feeding.development on Instagram, who is a feeding therapist and also lactation consultant. And so she'll talk about, again, all the different kinds of feeding issues that can go on, tips and things like that.
And if you're vetting someone who is online who we didn't mention, I would just look for the letters IBCLC. I can't vouch for that content, but that means that they are a certified lactation consultant, and I guess they'll be more likely to have evidence-based information there.
Yeah, hopefully. There's also a great resource just online. So I still haven't figured out how to get to it directly, but if I ever have a medication that I'm interested in learning more about the actual research on it in breastfeeding, I will Google the medication and LactMed. So LactMed is LACTMED, sticking those words together. So the medication plus LactMed, if you Google that, then that will lead you to the LactMed library that is part of the NIH. And that gives you all of the research. It'll give you usually a nice summary of the research, but then all of the research that's available on that specific medication in breastfeeding.
Yes, I use that one too. If it's someone's like, oh, hey, I'm on this thing, I've never heard of it, we can kind of look at that too.
Yeah.
Okay, there's a lot to consider when trying to figure out which ways to feed your baby best supports you and baby. We just want you to have the information, the things that we consider. We want to make sure that we do what we can to prioritize your goals and also your mental health at the same time. That would be the ideal thing for us.
Yeah.
So thank you so much for being here. Please like, comment, subscribe. We'll see you soon.
Bye.